How's it going? I'm here to set the record straight. Most of y'all think my name's Factor 5, one of those run-of-the-mill clotting proteins, and I'm not like my 20 to 30 brothers and sisters. I want to set the record straight. I am maybe the black sheep in my family. Some call me weird, a mutation, all that weird kind of stuff. But my name is Factor 5 Leiden. I don't like to be told what to do, so when jerks like activated protein C come along and tell me to stop doing what you're doing, it's not part of the system, I just go on my merry way. I keep doing what I do best, and that's facilitating clotting. So what if it results in some sort of, thromboembolic disorder that increases the risk of thrombuses that are stuck to the vessel wall, or things like embolus, which cause floating clots in the wall? Not my problem. I don't see why it matters. It's not like it's a big difference. Now that we're done with pediatrics, let's get down to the real information about Factor 5 Leiden. So I'll have to start out with a little bit of review on hemostasis. There are 5 steps that occur: vascular spasm, platelet plug formation, coagulation, clot retraction, and fibrinolysis. I've highlighted coagulation because Factor 5 is an integral protein to the creation of fibrin to help with clotting. In a normal individual that only has Factor 5, after enough fibrin has been produced, proteins go back in and deactivate several of the proteins, including Factor 5. But Factor 5 Leiden is actually immune to some of the action of activated protein C that would normally inhibit the production of later prothrombin activator. In these individuals, the clotting reaction is continued at a slower rate but does not shut off as effectively as other individuals. This can lead to issues such as thrombosis or embolus. Usually, when enough fibrin has been produced, activated protein C comes in and deactivates Factor 5 here. But Leiden Factor 5 is resistant to the effects of activated protein C and continues its activity. This disorder is a result of inheritance. There are 2 copies for the gene that produces the protein Factor 5. One or both of them can be a Factor 5 Leiden mutation. In heterozygous presentation, one gene is normal and the other one is a mutation. So, as a result, half of the Factor 5 proteins produced will be normal and half will be Factor 5 Leiden. In a homozygous presentation, all of Factor 5 proteins will possess the mutation. The more copies of the gene, the increased chance of clot formation. Factor 5 Leiden causes an increased risk for disorders such as pulmonary embolisms or deep vein thrombosis. It does not appear to affect or have an increased risk on heart attacks or strokes, however. Though there is no cure for this disorder, there are several treatment plans, including blood thinners, anticoagulants, and reducing several other risk factors associated with these clotting issues. Factor 5 Leiden is only one of several risk factors associated with abnormal clotting. By reducing other risk factors and maintaining normal weight, staying away from smoking or alcohol, abnormal clotting can be reduced and risks associated with this disorder can be minimized. It is important to note that simply having Factor 5 Leiden does not directly cause a deep vein thrombosis or pulmonary embolism. It is one of the many risk factors associated with these issues and other abnormal clotting factors. Obesity, cancer, immobility, surgery, or trauma and pregnancy are all additional factors along with others that can cause these issues. Factor 5 Leiden may increase the risks, but it is not the direct cause of many of these issues. In summation, Factor 5 Leiden is a thromboembolic disorder that results in an increased risk of abnormal clotting. It is a mutation of the clotting protein Factor 5 which causes resistance to the inhibitory action of activated protein C. This disorder is the result of inheritance, which results in one or both of the Factor 5 genes being mutations. This is only one of several risk factors for the process of abnormal clotting, and all of these work together to cause issues such as deep vein thrombosis and pulmonary embolisms.